There's been kind of an explosion of wearable devices and patch-type wearable monitors, implantable monitors, wireless data transfers from implantable EP devices. The big question the last few years is how do you actually manage all these disparate pieces of information in one location? And what was your previous solution and how does that compare to what you're using now?
So I think by definition, the nature of a lot of our practices, unfortunately, for better or worse, are characterized by having a lot of disparate platforms, whether it's ambulatory monitoring, the different vendors we use for our CIED implantations, and even just being able to talk between inpatient and outpatient EMRs. Some places are fortunate to have a single EMR that translates to both inpatient and outpatient. We use a different EMR on our outpatient side and a different one on the inpatient side. And so for us, it was really important to try to find a centralized solution. So you can try to make individual connections between each and every different platform you have, or in our case, we chose to pick a central platform that just pulled all of the other ones in. And so that just naturally sort of made more sense. And it also just improved our workflow. So that's kind of how we ended up choosing PaceMate as a solution, because we specifically looked to see which player in the field talked with all of our stuff. And it turns out they talked to everything.
But your old workflow, it sounded like it was a little cumbersome from your talk. So could you just kind of describe what you used to have to do?
Yeah, so I'll pick kind of a very tangible example. For ambulatory monitoring, we would place an order. It would have to go through central scheduling. Then it would go to the patient. They would finally schedule time to come in. So there's already now a delay from the time your order was put in to when the patient gets the monitor by almost a month. Then from there, they would wear the monitor, turn it in. The results would be downloaded, it would have to be printed, set separately for us to interpret, but then it would still have to be manually scanned into two sets of charts, the inpatient and the outpatient side. And even then, it wouldn't be billed. We still had to physically dictate the monitor just because the billing system had to be captured a certain way to be able to be registered. And so that alone sort of adds a lot of time, a lot of inefficiency by the time it's done, by the time we read it, by the time you get the results and act on them. But more importantly, it's a lot of extra work on the physician. It's a lot of extra burden. So that was our old workflow, but by incorporating a new workflow like PaceMate, what we do is we order directly through the EMR. Because it's already built in and there's bidirectional compatibility with the API, it actually just pre-populates, it pulls in that data from the patient that's not having to be manually entered or punched in by the person applying the monitor. It's ordered, it's pulled in, patient wears the monitor, we apply it in the office, and then when that monitor is done, it actually will pull any tangible or discrete HL7 data points into the automated read for us. So it sort of almost pre-populates a lot of the relevant data, so then it takes us a lot less time to sort it or peruse it before we kind of sign the report or kind of amend with whatever our individual interpretation may be. So it took us from like an 8-stage step that was full of kind of delays and hindrances to kind of basically a 3-stage process. Order it, results come in, sign it, and then from there it's populated to the charts and ideally to automated billing too, depending on where you are.
What's the time savings between what you used to do and today?
Oh, I think it's hard for me to quantify an exact time, but the difference between a monitor being ordered and then interpreted, you could easily wait, weeks to months, I think, between start to finish, whereas this, everything's turned around in a few weeks.
You've been able to refine your clinical workflow then with PaceMate?
Yeah, I would say so. Just like any new platform, I would be remiss to say it's not that we didn't have growing pains. We certainly did. But now that we're at a point where we've really refined it, I think the things that impressed me the most were not only were we able to incorporate all of the things we wanted to do, but more importantly, the team was very open with us in terms of how quickly we would be able to iterate on things, and we were able to actually be flexible about some of these things. When we started first with just CIEDs and remote monitoring. We wanted to make sure we had that down pat since that was the bulk of it. But the whole point of it was contingent for us to be able to bring in ambulatory monitors. And so we were able to do that too, and having them all in one place is great. Also having the flexibility to pull in other reports or other platforms, like for example, say, sleep apnea testing platforms or wearable cardiac monitors on the consumer grade side of things. It was a combination of needing to bring everything together and also having future flexibility. And it's even just integrating on small features like layout, being able to, how things are displayed, having dark mode. It sounds very small and petty, but when you're staring at screens all day, something as simple as being able to say, hey, do we have an alternate way to represent this data? It's small things like that to big things like being able to run analyses that have really, I think, been a boon for us.
Using PaceMate, it's my understanding that your center was able to redesign its wearable workflow.
Yeah, exactly. When we say wearables, I mean, I think the term sort of, encompasses a lot of things, but yeah, so we, just being able to go from the central scheduling and the other process, we intentionally, as part of the process, moved everything internally into the office, because being able to do those things in tandem with each other was sort of paramount to achieving that peak level of efficiency. Now, granted, depending on insurance companies, different people will have prior authorizations, other requirements, but there's still a huge difference between being able to say, okay, you order a monitor and within either immediately or within a few days have it placed in your own office with all that data pre-populated, versus an order going out and then having to wait till who knows when for that to get put in and then manually enter it, hoping the information gets put in correct and that there's no discrepancies from the data in the chart. Actually, I think we were one of the earlier centers, if not maybe the first in our area, to incorporate BioTel monitors into the platform. Originally they did not have any sort of compatibility with our platform or even with PaceMate, for example. But for us, because we use them on an inpatient basis, it was really important. It was sort of a sticking point for us to say, this has to work. And they were able to reach out to BioTel and coordinate with them to say, hey, if we want to continue incorporating these, is there a way for us to do this? And of course, they found a way to do that, and being able to bring in that data has been good. So now, again, whether we use iRhythm, whether we use BioTel, and even should we say choose to incorporate someone else in the future, having that flexibility and that option, I think is great.
Using the software, how does this help bridge all the categories of implantables and wearable devices?
So, I think ultimately having a central platform that pulls in every kind of device, whether it's a permanently implanted one, a temporary patch monitor, or even a consumer grade device, the benefits of it are that, number one, it pulls all of it into one place into the patient's chart that's easily visible. Number two, it improves efficiency in being able to navigate that data and make those correlations. And number three, I think it improves our understanding, because it provides us a way to sort of really dive into all of that data, because we can actually run analytics on it regardless of the platform or modality. And I think that's its major benefit.
Did the software help create any efficiencies for you?
Certainly. I mean, on a very basic level, just eliminating redundant and cumbersome workflows is a basic efficiency savings. But also something as simple as the natural way a lot of us navigate device checks and things is we're either printing reports or we're navigating the individual portal sites for these different vendors. But being able to immediately navigate those episodes even in one place, clicking between episodes and just jumping to it directly, being able to send notes to the device clinic directly internally through the EMR, that in and of itself I think is a great way to sort of provide time and efficiency value for us.
And can you discuss any clinical workflow enhancements that you've seen with PaceMate?
I think on a very basic level, time to diagnosis and time to therapy is the most basic one of those. We're certainly acting on things quicker, and also just simply triaging a lot of the information. We found out that about 2/3 of our alerts actually came in overnight or outside of traditional business hours. So number one, we get emails for anything that's critical early, so whoever's on call, immediately can act on it, reach out to the patient. But more importantly, the next day when, for things that aren't, immediately actionable but do need to be triaged, it's already triaged, ready, dispersed, analyzed, and ready for our device team and for us as physicians and our APPs to kind of look at and act on immediately, instead of just sorting through the deluge of information that showed up the next day.
And has this helped with improving outcomes at all, or help catch things that might have been missed otherwise?
I think you're always going to catch what you need to catch as long as the monitor's being on, but how quickly we're able to act on it and get them plugged into places, I think that's where this sees a huge difference. For example, we have an atrial fibrillation clinic, and we were able to sort of put together, our workflow. We started on a small scale there, and being able to get people plugged in immediately. There is data, and our data reflects that as well, where atrial fibrillation clinics reduce the time to diagnosis, time to therapy, and basically patients have better outcomes. They do better, they feel better, and they get the treatment they need sooner. And so part of that is not just having that clinic or having the right people there or offering the right tools, it's also having the right diagnostics and being able to pull that data and act on it quickly. And that's this side of the equation that I think PaceMate provides us.
Has there been any help with the software in terms of charge capture reimbursements?
I think that varies place to place. For us, it does automate billing to some extent, but you will find that every institution runs things differently. Some people, it at least collates them or organizes in one place where you can act on or submit them all at once. Other places, it'll automate and even submit your billing, but that varies from institution to institution.
What can you tell me about the analytics? How is this helpful? How do you utilize it?
So for us, we use the analytics in a few different ways. And again, I think every practice will be different, and people will find very creative and useful ways to do it. I think on one hand, there's research indications, so you can immediately see, okay, of all of my patients, how many of them are on X, Y, and Z medical therapy? What are their outcomes? You can try to see if there's any connections between certain interventions you've made and what you find in your devices. So I think on a research side, there's some analytics that way. I think on a practical side, there's also just trying to coordinate where you may set up your outreach clinics or device clinics, having that geospatial distribution of where all your device checks are, or where your patients may be transmitting from, trying to figure out whether they will have that. You can sort of allocate your resources, I think, more efficiently. And then on a third level, besides just research analytics and planning your kind of utilization of resources, just patient care and optimizing some of those things, being able to figure out which of your patients, for example, have a reduced ejection fraction and a more than 50% pacing burden, but don't necessarily have biventricular therapies. It's like, is there a reason for that? Being able to, those are patients that potentially are candidates who would stand to benefit from some of these things. Now, granted, there may be individual reasons in these different cases, but just at a snapshot, being able to see who are these people, who falls into which categories, what are we addressing, have we missed anybody? I think all of those things are advantages that these analytics allow us to do.
Can you tell me a little bit about how the software helps with multi-platform integration in the community hospital setting?
I think on the simplest level, just having everything pulled into one place for visibility, to be actionable, and more importantly, for redistribution, I think is paramount to success. And I think that's kind of ultimately what it's done for us in many ways. And granted, there's always room for improvement, there's always room for refinement, and there are growing pains with all these things, but for us, compared to being able to check every single platform individually, pull it in, sometimes manually scan it, sometimes having to just fax something over, being able to have it all digitally incorporated into one place, I think is a huge advantage and benefit compared to what we were doing before.
And what advice do you have for centers that are trying to integrate all their sources of EP data into one location?
I would say, I think two major things. Number one, work with the tools that you have. Ultimately, it's very difficult to say, hey, we want to incorporate this extra vendor, or we want to pull this in. I mean, there are always limitations on what you can and can't pull in. And so working with the tools you have is one, but partnering with an industry partner that is going to have a mutually aligned vision or help you meet your goals and work with those tools that you have. That's, I think, the second thing I would recommend. So for us, we knew these are the tools we have, this is what fits in our box. Who can we work with that plays nicely with these tools? Who talks to all these boxes? And so for us, that's how we made our decision.
You probably compared other EP integration systems out there, and what are some of the key differentiators that you were looking for and that you found in what you are using now?
I think on a personal level, the team that you work with, the people you talk to, I think we just had a good relationship with the team, and we were able to find that they were personally not just available to us, but also willing to talk to us and integrate on large and small features all together. On a practical level, it's also just who works with the tools we have. We use a particular EMR on the outpatient side, we have different EMRs on the inpatient side, and so we wanted someone who would be compatible with all the tools that we have already, and that's kind of how we made those decisions. If you use, for example, a PaceArt or another platform, it will pull in certain data from devices, but there's HL7 components in it that it won't pull in. So you kind of have to either manually set those in, or there's just blanks in those fields. And sometimes they're germane to what you're dealing with, and sometimes they're not. But again, having a platform that actually pulls in all those data, that's platform agnostic, so to speak, I think is huge. And that I think is somewhere where it matters.
How about the interface? Is it an intuitive interface, or did it take a lot of training?
Oh, I think the interface is pretty intuitive. Most of us are familiar with most EMRs already. I would say compared to a lot of EMRs, it's very intuitive. Is there room for improvement? Always is, but what I've been impressed with is how flexible they've been. Even in the short time that we've had it, we've already made modifications and adjustments to the interface unique to our practice, and those are what I like is that those things are customizable, not just practice to practice, but even to some degree physician to physician within the practice.
And what is it like to work with the company?
Yeah, I mean, our experience has been good. I mean, we had growing pains starting, but they were adamant to address them, and we were able to navigate most of those issues. And I think our relationship has been great. I think it's been very helpful to us, and we've been able to sort of work through a lot of things to get it to a point where it's fully functioning and working well. And granted, there's always new things that come up, but being able to feel comfortable to address those things, I think, is huge. Being able to know that when I address something or have a concern, that it'll be addressed, that it'll be handled, I think that's very helpful.
And what's the most impressive aspect of the software that you found?
That it works.
Would you recommend PaceMate to your colleagues?
Yeah, I would. I think it really depends on your personal goals and what you have, but I think I could imagine very few instances where it wouldn't benefit or be a boon to a modern day EP practice.
And what has the impact been integrating all of your ambulatory monitoring with PaceMate?
Just efficiency at the most, and again, being able to pull in that discrete HL7 data not only has made our reads faster, but also more accurate.
And you had mentioned the software integration. It looked like you had 3 different EMRs that it went into. Can you explain how well it integrates with the EMRs?
So we have one EMR on the outpatient side, we have another one on the inpatient side, and then we have several different vendors that we work with for ambulatory monitoring, and they have their own cloud-based platforms, and then of course all the implantable cardiac devices, and those have their own platforms. So just not having to have 9 tabs open to navigate all those, and being able to just have one tab open, being able to jump between those, I think has been the most beneficial thing for us.
Do you use PaceMate monitoring service as well, and if so, how has that helped with care?
Yeah, I mean, I think so. We use the kind of traditional subscription model, so they will address anything overnight. They monitor all that, they triage that information, and anything that needs to be that meets our actionable criteria, we're alerted about right away. When you establish it, there's actually you kind of set your own criteria for what you do and don't feel warrants either something as minor as like an email, a leave it alone, or a hey, this needs a phone call at 2 a.m. And so you can set those parameters individually. And so when we first started, we were particularly conservative with those parameters. I would rather know about everything and then find out later. It turns out I can dial back on some of those things. I don't need to get an email or a phone call about every single one of these. But that's customizable time, practice, and based on your needs. So I think that part has been kind of helpful for us.